Colorado has opened up more tiers to vaccinate people, so a lot are wondering what this means in terms of how we can behave now. Dr. Dave Hnida is here, and so what can people who have been vaccinated really do?
Well, you have to take a look at really people who are fully vaccinated, and you are considered to be fully vaccinated if you have had your second dose of the Pfizer or Moderna, and you go the 2-week period after that second dose. Or if you had the single dose Johnson & Johnson vaccine, it is 2 weeks after you get that single dose. So in essence, 2 weeks after you are vaccinated, you are considered to be fully vaccinated. Now, what can you do if you are fully vaccinated? Well, if you are getting together with loved ones, friends who are also fully vaccinated, boy, we really just had a big relaxation of restrictions. We are back to a situation where if you are getting together with people who are also fully vaccinated, it's no masking. We're back to hugs and handshakes and really some very optimistic things. It gets a little bit more complicated, though, when you have people who are partially vaccinated or unvaccinated. In this particular situation, the consideration is that even though you may be fully protected, the CDC is now saying that masks may not really be necessary if you are having a small gathering with people who are partially or unvaccinated. But you also need to take into account whether or not they are elderly, whether they are at risk for any medical conditions that would put them with the possibility of bigger problems if they would contract COVID. And also if they are in a household where they live with someone who is in higher risk of complications if they would contract COVID. In this particular type of circumstance, I think you really want to be continuing to mask and maintain distancing and so forth. Now, what about if you're fully vaccinated, you're going out into the general public, of which many people may not be vaccinated? A lot of cautions here as well. You need to still consider all of the things that we've been talking about for so long: masking, distancing, good hygiene, and so forth. A lot of caution when it comes to things like indoor dining, non-essential air travel, for example. So I think you need to take a look at being vaccinated as you don't really get a get out of COVID free card. Things are better and things will continue to get better, but there still needs to be an awareness that we need to continue to follow some pretty good behaviors here.
Yeah, great information, because I know a lot of people have been wondering that, and it's just a little confusing for everyone what exactly they should be doing. So we're now more than a year into the pandemic. What have we learned about treating patients?
Gosh, when you take a look at 1 year ago, let's just say March, April of last year, COVID was really a brand new disease to us. And in terms of treatments, we didn't know really the specifics about the best way to treat it. We were relying on advice from physicians from other countries who maybe had a little bit more experience. But over the course of the year, as you've seen, we've had changes in our advice, and we've had changes in treatment as well. We have actually seen in many areas that survival rates after being in the hospital are double what they were about a year ago because of improvements in treatment. And that includes things like use of steroids, remdesivir, things like making sure that we are using ventilators a little bit less often than we otherwise did early on, understanding that ventilators can be a little bit hard on fragile lungs in people with COVID. We've also learned that having people lie in a prone position or on their stomach actually increases lung capacity and helps to protect the lungs. And we've also learned that blood clotting, especially microscopic blood clotting within the body, is a big thing when it comes to COVID. And we didn't know that early on, but now we are taking that into account and treating that preventatively. And so in essence, the treatment has just gotten so much better. But it is really important to understand that, number one, there is no cure for COVID at this point in time. We still have worries about people who are getting sick and dying from COVID, the best treatment at this point in time remains prevention.
Absolutely. And we know Governor Polis has extended the mask mandate for Colorado for another 30 days. Do you think that's reasonable with the increase in vaccination rates?
No question. I think when you look at the big picture, where are we in terms of herd immunity? You know, there are some estimates that say, well, maybe we're about 30%, 35% herd immunity at this point in time. And really, we need to get to about 80, 85% before we have herd immunity, and we can pretty much go about business as usual. I think at this point, you take a look at things like mask mandates. We know that masks are, short of just total isolation, probably the most effective tool we have when it comes to preventing the spread of COVID. Now, if you take a look at what's happening in other states who are getting rid of their mask mandates and other limitations just abruptly, you say to yourself, well, you know, where's that line of thinking? COVID has not disappeared. COVID is not a disease that has an on and off switch. We still have COVID in the community, and it is going to be a gradual lessening, I think, of restrictions as things continue to improve. In Colorado, we do have a few things that are of concern to us as well as elsewhere in the country. We are worried about things like virus mutation and variations in strains. We're worried about things like spring break is coming up. We have an increase in tourism as people come out to ski from other states and so forth. And then we take a look at things that took place just recently up at University of Colorado in Boulder. These are things that are a concern to us. So I think it's important to remember that, you know, you may not like wearing a mask, but a mask is going to keep you from getting sick. A mask will help get businesses open, keep schools open, and those are really important points at this point in time as we move forward, and we're moving forward quickly toward getting back to a sense of normalcy.
Which I'm sure a lot of people are feeling thankful to see. Well, thank you so much, Dr. Dave. We really appreciate it. And we'll talk to you again next Monday at 11 a.m. to get more coronavirus and vaccine questions answered. We'll be right back.